Oh, difficulty getting through, but I'm in now, so that's excellent.
Awesome.
Sorry
How
to
did
keep you
you
waiting.
get such a good line?
I beg your pardon?
Said, how did you get such a clear sounding line?
I have a headset. But we had trouble getting in the first place with a busy signal. We're just waiting for Kathy Dermott to come on the line to moderate. It'll just be a moment.
Sure thing.
No problem.
Okay.
Is someone else there? Hello?
Oh, I'm here, Dr. Gardner. Just waiting for Kathy. I do hear a dog barking, so if people could mute their lines apart from when they're speaking, that would be great.
Yeah. I'll mute that.
I just tuned in. If Kathy's not able to get on, I can start the conference if you'd like.
Okay, everybody. It's Dr. Gardner here. Just checking in to see if you can hear me. I had to switch over to speakerphone. Can everybody hear me well?
I hear you. Yep.
Okay, so I've also got Kathy Dermott in the room with me to moderate. So welcome, everybody.
Thank you.
We have updated our web page with our tally of cases. What we have listed is a total of 12 cases to date. Should tell you that, in fact, we have 2 more that are just arrived and being processed, but I won't be able to speak to them because of the timeliness of them, but I will be able to speak of the other two cases, the two other new cases. So one is a woman in her 70s living in Aurelia who is admitted to Aurelia Soldiers Memorial Hospital and is a community-acquired case. She has no travel history or no history of contact with a case. The other is a 52-year-old man from who traveled to the United States, lives in Simcoe County, and is now presently hospitalized in South Lake Hospital. Those are the updates for the new cases. If you look at our page now, we've got some overall statistical information about the 12 cases that we've listed on that page, noting there are 2 more to be coming. But provides a breakdown of the age ranges of the cases and also their status. So if you look at the status of the cases, we've got of the 12, 6 that are recovering at home on self-isolation. We have 4 that are hospitalized, and we have 2 who've deceased. And it also provides information on their means of acquisition, how they acquired their infection. So 7 are listed as travel-related, 2 are listed as close contacts of other cases, and 3 of them are listed as community-acquired. And then we've also got an epidemiological curve that plots the dates that the cases were confirmed over time. So I think all of this is meant to give you, I think, a bigger picture of the cases we have in our community and how this is unfolding. I think it's really important. I always like to go to the takeaway messages in this. And so for me, a really important takeaway message is we are definitely seeing the onset of community-acquired cases, transmission in our communities. And we've had a significant number of cases that are severe cases requiring hospital admission. So all of this speaks to the importance of people being aware of the hazard of this virus and the need for them to distance themselves from others. We've called it social distancing to date. I think we're going to shift over to call it physical distancing because we're becoming aware of the negative impact on people's well-being if they can't maintain social contact in some way with other people. And so people need to be using other means of being connected with each other rather than being in physical proximity to each other, using the information technology that we have today at our disposal to be connected with people at this difficult time. But they do need to exercise the physical distancing of 2 meters from each other. They need to think carefully about whether or not they really do need to go out. One is safer at home, and they need to be exercising frequent hand washing and avoidance of crowds. And if people do develop symptoms of respiratory illness, they need to self-isolate in their homes. And if they develop severe symptoms, seek medical attention, calling ahead before they go. Now more than ever, this is very important. If we all abide by this, we can flatten the curve on this situation and help to avoid having a major surge in cases that will exceed our capacity to respond. I did receive some questions that were submitted to us in advance of this teleconference. I'll actually go through those questions, and then I'll turn it over to yourselves to ask whatever other questions you may have. So, first of all, there's a question about how is the health unit preparing for the arrival of snowbirds coming back into Muskoka, the way it's framed, certainly coming back to anywhere in Simcoe-Muskoka. I would say that that's a critically important point. We've seen majority of our cases to date travel-related. And although we're concerned about community transmission, we're still concerned about people bringing this back with them from travel anywhere out of the country, including the United States. 30% or so of travel-related cases in Ontario have been related to travel from the United States. So it's very important that people be aware that when they return to Canada, they are to go into home isolation for 14 days and to seek assessment if they develop symptoms. And we continue to promote that messaging. That came from the Chief Medical Officer of Health of Ontario. Also before him, it came from the Prime Minister of Canada. So we continue to promote that information. At the end of the day, it's up to people to abide by this. We don't have the capacity to enforce this with the numbers of people that come back. It's don't know who they are. It's critically important that they receive the message and that they abide by it. There's questions about special screening processes in place for returning snowbirds or returning individuals from overseas travel. The question frames it in terms of hearing of reports of such people stopping at the grocery store to pick up supplies and ignoring the isolation orders. And I would certainly emphasize that that would be a dangerous thing for them to do. When they are, in fact, to completely abide by this requirement and to directly go home into isolation and stay in their home for the 14-day period. There's a question about when and where will Muskoka see assessment centers. My understanding is that work is underway to have an assessment center in Huntsville and in Bracebridge, and that they hope to have them running next week. It's up to the province to approve having them open. And indeed, I think it would be a very good thing to have them open. We do have some open in Simcoe County, Barrie, Orillia, Collingwood, and now in Allison as well, Midland. So a good number of them in Simcoe, and we do indeed need them in Muskoka. And then there's a question about people coming back into the country, being told to go into self-quarantine when they go home. What is the difference between quarantine versus isolation? In fact, they are the same thing. Quarantine is the traditional epidemiological term for a well individual who's been in contact with a communicable disease and may be incubating it and therefore has to put themselves out of the way of others in a safe place so that they can't transmit it to others if they become symptomatic, infectious. And so that's a traditional term. More recently, we've heard the term isolation or self-isolation or home isolation, essentially referring to that situation where people have been in contact and need to be away from others so that they won't expose others if they become communicable and symptomatic. And certainly there's a question about can they go for a walk if they have if they maintain social distancing. Okay, so social distancing is yet another term, and now I would like to call it physical distancing. It's the idea that people who aren't in isolation at home, when they choose to go out, need to maintain a 2-meter distance from other people. They need to avoid crowds. They need to consider whether or not they actually should be going out at all. Right now we have in place requirements from the province that all unnecessary work environments, non-essential work environments be closed, schools maintain closure. These are measures to help support this whole idea of community distancing to reduce the amount of mixing and exposure that people have in the community and therefore flatten the curve of the transmission of this pandemic in our community. So at this point, I'd be happy to take questions from.
Okay, so Kathy, actually, I wondered if we could, if each person, if you could actually identify yourselves first, and then we can go through. So I know we have Mike from CTV. Who else do we have on the line, please?
Nathan from the Moose.
Hi, Nathan.
John Schwartz from Sun Online.
Sorry, just one at a time.
John Schwartz from Sun Online.
Okay, who else?
Agatha Farmer, Muskoka Post.
Okay.
Dina Goldfinger, Global News.
Alrighty.
Chris Simon,
Muskoka Region.
Sorry, Brett, 360.
Actually, I'm Brett from 360, but I'm here too.
Okay, and that's someone from Muskoka Region?
Yeah, Doug Cross from Muskoka Region.
Chris Simon from the Barrie Advance.
Okay.
Catherine Thompson from Max FM Radio.
Okay.
Erica Engel, Collingwood Today, It Really Matters.
Okay.
Dawn Huddlestone, Huntsville Doppler.
Okay.
Trina Burlow from the Creemore Echo.
Okay. Anyone else?
Don McNeil from MyFM.
Anyone else? Okay, let's start with Mike Arsuides. You have a question?
Yes, thank you. Dr. Gardner, what in particular in the community are we hearing from, especially public safety?
I am troubled to see community-acquired cases that cannot be linked to travel or to another known case that's linked to travel. This speaks to the risk that's in the community right now, that it's entirely possible for any of us, when we go out in the community and interact with other people, to get infected with this virus. I'm also troubled by the number of cases that required hospitalization that are severe. And I would therefore caution people that this is a serious infection. They need to take it seriously. They need to emphasize that physical distancing.
But not to dumb it down for folks, but how is it in water? People
I'm sorry, can you repeat his questions? We can't hear him on the line.
Okay, maybe Kathy could do that.
Yes, he was asking, his first question was what troubles Dr. Gardner that he sees out in the community, and the follow-up question is, can we simplify what community-acquired means?
Okay.
For people who don't understand why this is spreading right now, what the hell are we doing as a result of seeing these numbers increasing? What should we do better? What are we, because for example, you don't want your kid over at sleepover with 6 other kids and then coming home and bringing whatever carrier, right?
Yeah.
People are they?
Yeah, I mean, this is very serious, and so people need to know what puts them at risk and therefore what they can do to reduce their risk. So this is spread by droplets from your airway, touching your mucous membrane. So in other words, if you're close to an individual who has this, breathing in your direction within a 2-meter distance, coughing or sneezing can allow for virus to carry in droplets in the air that then can be breathed in by you or can touch your eyes or your mouth, your nose, and then you become infected by it. It then enters your body and propagates and causes the illness. So people need to be aware it's that easy. They can also get it from surfaces. So a person could cough, it could settle out on a tabletop or a doorknob, and by touching it and then touching your face, particularly your eyes, your mouth, your nose, it then enters your body and infects you. So it's really important that you do your best not to touch your face. It's hard not to do. And that you wash your hands frequently through the day. Hand washing has been shown to be the most effective thing that you can do. And so your point about sleepovers is an important one. Right now we're asking people to, as much as possible, stay home. Keep your family members at home. If you do go out, you need to be exercising that physical distancing that I'm talking about. This, of course, is very hard on children, the idea of not playing with other children, but it is necessary at this time. Children aren't actually particularly prone to developing severe symptoms, but they're very good at spreading it to others. And so they can be a means by which this propagates in the community and by which people who are vulnerable, people who are older than 60 or 70, and people with pre-existing medical conditions, if they acquire this, they're much more likely to get a severe outcome requiring hospital care, intensive care unit care, or even death. So very serious. People need to take to heart the fact that they've got to do that physical distancing, and they have to abide by the recommendations and requirements right now coming from the province and from public health.
One last thing out of here. So do any indication of where that 70 was? And you were yelling in this detail. If you go to the grocery store and grab everything, don't packed up. How do we?
So this was a woman in her okay, Kathy, I'll let you repeat the question, sorry.
Oh, yes. The question from Mike was, do we know how this woman acquired the infection? This is the community-acquired one, correct?
Yes.
Yes.
So this is a woman in her 70s. We have been unable to determine how she acquired this infection. She doesn't have a travel history, and she doesn't have a history of having been in close contact with anyone who's known to be a case. So we don't know how she acquired it. We do know her contacts since developing her symptoms, and so they've been approached and required to go into home isolation.
Okay, that's very good. Nathan, do you have a question?
Yes, I do. Thank you. Good afternoon, Dr. Gardner. So I have a kind of a two-parter question here. So as the cases grow and we have more people who are coming in with who are confirmed cases, not all of them have the resources to call upon people to go do errands or other stuff for them, and who are at home isolating. What do you suggest for those people who need to go out to get stuff for them, like basic amenities like medication or groceries, or for people who don't own a laundry machine and have to go to a laundromat? What do those people have to do?
Clearly, there are people that are going to be in a very vulnerable situation, both with home isolation, but also just with the social, or what I should say, physical distancing recommendations that we have. And there's no easy answer for that. People have to call upon their family and friends and neighbors as best they can to assist them if they don't have provisions at home to take care of these basic needs. And if they don't have that, then I guess I would recommend reaching out to the community services. That's going to be increasingly more difficult as well because of the restrictions that are put in place now about the operation of workplaces, for example. Maybe this is a really good opportunity for all of us to become very neighborly and to think about people who are vulnerable, and to through distance means that are safe, communicate with them and offer your own assistance if you, in fact, are free to be able to go out and take care of these, to lend them a hand with these things.
Great. And kind of question two. So the list that just came out for non-essential businesses that should be closing, what does this message promote? Because obviously we've had several businesses who are already closing, but from a medical perspective, what does this help do besides kind of reducing the risk of possibly spreading the viruses among the small mom and pop shops? What other purpose does this serve with trying to stop COVID?
So this is an extension of the actions taken to date in support of social or physical distancing, and it all helps, basically. If people respond to the environment around them, to cues around them, if we give out a message that they shouldn't be going out and they shouldn't be gathering in crowds, and yet they're otherwise free to do so, and everything's open, and they see that everybody's continuing to do that, then they tend not to respond. And that has certainly been seen in other jurisdictions elsewhere, and where it's proved to be necessary to actually shut down public venues to get the message across. And also, people will they'll be safer if they don't have their work requiring them to come in and be potentially exposed to others in the community. So this makes it safer for people because they don't have that demand that they would have a very difficult time saying no to. Certainly right now, on the big picture, it's critical that we do everything that's reasonable to reduce transmission in our community and to flatten the curve.
Do you think a full...
Sorry? Is it my turn now?
No, it's Agatha's turn.
Well, I thought I was third in the list. Okay.
Good afternoon, Dr. Garden. How are you?
Busy?
My question is, you said that next week Huntsville and Bracebridge are supposed to hopefully see some assessment centers. Could you tell me a little bit about the approval process for those, and what is the timing on that, given that Muskoka has a rather large senior population? Thank you.
Certainly, I think it'd be a very good thing to have it open and available for assessment. And I agree with you that a large senior population is an indication of vulnerability in that community. The ultimate approval process rests with the province, and I'm not actually privy to how that is done. I do know that there was a call out for applications to the Ontario Health Agency's Central Region for proposals for such sites, and that's how they're vetted and viewed and considered by the province. That's how they're received. Over a month ago, as a health unit, we reached out to primary care leads and also hospitals and the local health integration network to identify such sites and get work underway to have them prepared and ready to go. And so I think that's helped to have the number of sites we have already open, and it's helped to have these other two getting ready to open. But I don't have further information for you about the details on that.
Do you have a follow-up question, Agatha?
Okay, thank you.
Okay, John, let's keep her short.
Thank you. I looked at the Ontario website before this call, and they showed 573 cases confirmed and 18 times that number under investigation. So we have 12 cases. Is it reasonable to assume, or is there anything to indicate that we're up around the 220 unconfirmed?
We don't know at the health unit how many tests have been ordered for our district. We don't get that information. They're done by local physicians. So we don't have an exact figure, but I have every reason to believe that we could be in that range. I do know that there's a significant amount of testing that's being done, referred from the assessment centers to the emergency departments to be done. My main concern actually is not only how many more tests are pending, but how many more potential cases are out in the community that have not been able to be assessed, or perhaps are very mild symptoms and haven't sought assessment. That goes right back to the importance of the physical distancing that we need to be doing to safeguard ourselves, reduce transmission, and flatten the curve.
Do you have a follow-up question, John?
Yes, I do. I was trying to research, so you've got the disease, you're at home, now what? And there is surprising little information available on how to treat this stuff at home. One thing I did find was an Italian doctor who published an article in Lancet who said, do not take ibuprofen, it aggravates the recovery time, and people should be taking acetaminophen. Do you agree with that? And what other things should people be doing at home to, if they become ill, to start feeling better?
So at this time, I'm not aware of any specific treatment that may or may not make a difference. I think taking acetaminophen would reduce aches and pains and fever, but wouldn't change the course of or the outcome of the infection. To me, there are two things that are critical. One, maintaining the isolation so that you don't expose others, and for individuals who may be a case, and I think there's much potential for people to possibly be a case, suspect they're a case, and isolating themselves for it, but may or may not ever be able to get tested because of limited access to testing. So if you are a confirmed case, or you may be a case and you don't know, really important that you not expose other people. You don't go out. You don't go out if you've not been tested. You don't go out until you're fully recovered. At this point, we're saying or 10 days, whichever is longer between the two, and that's, I think, subject to change over time depending on what more we learn about this virus. And for other people in the household, maintaining your distance from them to reduce their risk is really important. So setting aside a place that's yours in your abode, separate from the others, and a washroom that's yours if possible, and eating separately would be important. And for the others, that they, it depends. If they've been identified as contacts of a case by us, they're probably also in home isolation because of our requirements. If you're not known to be a case because you haven't been able to be tested, then the other individuals need to be monitoring themselves and putting themselves in isolation if they develop any symptoms. So avoiding infection of others is key. The other message I would have is monitor yourself as a potential case or as a confirmed case, and if you develop severe symptoms, and in particular shortness of breath, then seek medical attention at the emergency department if in fact you're short of breath. And calling ahead to forewarn them that you're coming would be important from an infection control point of view.
Okay, Dana, would you have a question? Dana?
Sorry, I was just putting it off mute. Yes, I do. So it came to my attention this morning that there's been at least one other local health body that started listing possible places of exposure within the community where positive cases have been. Does the health unit have data on this, and will it be released against the public?
So maybe I'd have to explore a little further with you about the details of this. That's very broad language. Well, we've communicated with 2 cases that were treated at the Royal Victoria Regional Health Centre, RVH, that initially those cases weren't identified as COVID cases, and so there were a number of staff exposed in that situation who've since gone into home isolation for monitoring. We've been forthcoming certainly about that situation. And there are no other situations like that in Simcoe-Muskoka that have been reported to us.
Follow-up question, Dana?
Yeah, and as well, I'm not sure if I missed this in the beginning or not, but I thought I heard you mention there were 2 additional cases than what we're talked about today, but they just haven't been updated yet. Is that right?
That is right. The information's just come in, and we need to review them, follow up on them. So I'm not prepared at this point to give details about them.
Okay, Brett, do you have a question?
Sorry, just taking you off mute there. Just the one question for Dr. Gardner. Thanks. The health unit's been probably pretty slammed of late, but you've definitely stressed this physical distancing several times. I mean, mental health calls are taking up a lot of the health unit's time, probably adding a lot of pressure.
It's a very good question because there are undoubtedly mental health impacts from the situation, and I think that they will mount as time goes on, as all of these changes continue to be in place and impact on people's lives. Isolation is hard on people, and the Canadian Mental Health Association has identified that and spoken in the media about the importance of a focus on people maintaining social connection. If they can't be if they have to be physically distanced, then they need to be socially connected, and they need to use their means at their disposal, technological, to maintain contact with each other, and this will be a great challenge for us all going forward in time. At this point, it's not a lockdown. We're not prohibited from leaving our homes. That is the case in certain European countries, such as Italy, Germany, Spain, and I think that they would be at an even greater risk right now of having the mental health impacts of isolation. And as a workforce, we need to be, internally to the health unit, we need to be mindful of this as the demand of responding to this situation continues. Certainly, other work environments like hospitals be all the more so, as well as they deal with the stress of potential exposure to cases and the need for themselves to exercise caution and use their personal protective equipment and doing the screening required to safeguard hospital environments.
Follow-up question, Brett?
No, that's fine. Thank you very much.
Okay, Doug?
Hello. So we have a lot of readers that are suspicious in the Muskoka area of the lack of cases, lack of statistics. You pointed to testing and reporting of test results as an issue. Is there not a standard reporting protocol from physicians up to the Chief Medical Officer of Health within a health unit area? What is that process currently?
So this is a legally designated disease of public health significance, or a reportable disease, which means that all laboratory tests that are positive are to be reported to the local medical officer of health, to the local health unit, for us to be able to act on, to take action to protect people. And that process is in place, and it is happening. In fact, it's even better than that, or stronger than that, in that we're getting negative test results as well, which is beyond the actual requirement of the law. Tests, swabs are done primarily at emergency departments now, some assessment centers, and sent into the public health laboratory system to be tested. Now, there's, I would say, a bottleneck happening in that there are many more tests being taken than the ability of the system to process at this time. And so some other hospitals in the Greater Toronto area are coming online with their laboratories being able to provide this service as well to increase system capacity. But they, too, are to report their positive findings, their positive test results, to the local medical officer of health for action.
Follow-up question, Doug?
Yeah, I'm just wondering, is there a hypothesis as to why there's no cases in Muskoka? Is it just relatively low testing at this point? Because statistically, it doesn't ring true that there should be zero cases.
Yes, I hear your concern, and we do need to know what's going on in Muskoka every bit as much as Simcoe. And it does rely, the system, on tests being done. The emergency departments certainly are doing testing. There aren't assessment centers yet, so that, I think, is a challenge, and it will be a good thing once they are open, because it will help increase the volume of testing that is, in fact, needed in Muskoka.
Chris Simon, do you have a question? You're on mute. Chris? Max FM?
Yes, thank you. Hopefully I didn't miss this already being asked, but Doctor, you said that one of the latest patients, a 52-year-old man who lives in Simcoe County, traveled from the U.S. and is now in South Lake Hospital. Where in Simcoe County does he live?
So this man in his 50s who lives in Ajala, Toronto.
Okay, thank you.
Is that good for you, Catherine, then?
That's good, thank you.
And Chris, are you there yet?
Yes, I am. My phone just died, though. I clearly need better ones in my home.
Okay.
So I apologize. I may have just missed an explanation for the question I was going to ask about, but could you just maybe give a little bit more details on the on cases 11 and 12? Where are the residents from, and what hospitals are they currently in?
So the man in his 50s who traveled to the U.S. And is in hospital in South Lake, hospitalized in South Lake Hospital, is from Ajala, Toronto, and the woman in her 60s who lives in Aurelia and is presently hospitalized in Aurelia Soldiers Memorial Hospital is what I'm calling community-acquired case. There's no travel history or history of exposure.
Follow-up question, Chris?
Yes, a number of municipalities have declared states of emergency over the last couple of days, and it's primarily on the advice of health professionals like yourself, Dr. Gardner. Can you just emphasize what the importance is from a health perspective of declaring that state of emergency?
Well, it's really critical at this time that everybody take to heart and implement and act on physical distancing and all that I've spoken to, the hand washing, the maintaining of 2 meters from other individuals, really considering carefully whether or not you actually need to go out, avoiding crowds and isolating if you develop symptoms. And the province has taken quite a few actions to support that, including declaring a state of emergency. I've had some municipalities ask me whether or not they should be declaring a state of emergency. My advice back to them was it's not clear to me what additional powers it would give them, but what I believe it would do is further signal to their citizens the importance of this infection and the importance of them abiding by that physical distancing, taking it to heart and acting on it. They've mostly accepted my advice with regards to, actually all of them that have asked have taken my advice with regards to that rationale. Municipalities here have done a number of things in addition to what the province has done. Before the province indicated that they needed to be closing their facilities, they did so, and some of them have asked whether or not they should be making changes in parks, such as closing playgrounds, considering that children will tend to come very close to each other and will touch surfaces that could be contaminated. And I indicated that that would be a reasonable thing to do. That's the kind of thing that the province alone doesn't necessarily do or hasn't done, that they've chosen to go ahead and act on.
Okay, Erica, do you have a question?
Yes, I do. My question is regarding your process for investigating close contacts. How far back do you go, and are you struggling as more cases come in?
Thank you for those questions. We take a detailed history from the patient or family members, people who have information about date of onset of the symptoms and the whereabouts of the individual involved and who they've been in touch with. And from that, we look back to the date where their symptoms began, and we go 24 hours before that date and work forward from there and identify everybody that's been in direct contact with that person and then put them into home isolation. Or if it turns out it's a public location that we need to reach to people who've been at that location and we're unable to get them by other means, we use the media to do so. And yes, indeed, as the case count grows, the demand on staff is growing substantially, and it's not just the laboratory-confirmed cases, it's the many others who are concerned, who have questions or concerns, and we've completely redeployed all of our staff, with the exception of very few that are held back to do things that we simply can't stop doing for general public safety for other issues. We've redeployed all those people to enable our response to this situation.
Do you have a follow-up question, Erica?
Yeah, I'm just wondering about the 24 hours before symptoms. Is there no data suggesting that they could be contagious before that 24-hour period?
We are learning as we go. This is the recommendation from the province to date based on their review of the data, the research that shows that there is a potential for some transmission before the onset of symptoms. What's worrying to us is some data that suggests there's the potential for transmission for people who have very mild symptoms who never seek medical attention, such as children, or even people with no symptoms. And so this takes us right back to the importance of social distancing. I've called it. We need to change that to physical distancing so that everybody maintains that distance from others, period, because you don't know in the community who is presently shedding virus and who is not.
Don, do you have a question?
Yeah, just a quick one. Thank you, Dr. Gardner. Everybody, you're talking about mental health issues and physical issues with people as well. But the question I'll ask you is we're talking about everybody else. How about you? How is your staff? What's been the effect on you guys?
Thank you very very much for asking. Personally, I'm well. I appreciate the question, and I would say that I'm in mind the importance of self-care. There's been a constant flow of emails for me to keep up with, but I realize I need my sleep. I need to get to bed and get a solid night's sleep, and I need some time to get some physical activity, maintaining that physical distance from others, but nevertheless, I'm doing my best to take care of them and have a supportive home environment, so that helps a lot. I did a certain amount of shopping as we were getting into this so that I would have the provisions to be able to undergo isolation myself if necessary. And we have a bigger question about our staff. There are many people here working all through weekends. That can't be sustained. We've started shifts for people so that covering the weekend is done by other people. It's not an expectation that everybody works around the clock. I would say lead managers on this topic are particularly vulnerable with their workload, and that's something we need to work on to improve, I would say, for their own well-being and sustainability. This is going to be a marathon. I think it will go on weeks to months. It may very well happen in waves in the spring and then in the fall again. We need to be able to do this in a sustainable way. We need to be able to take care of our own people, and we need to support them in taking care of themselves and their family members. And we also need to have really good infection control in our premises, our facilities, so that this infection doesn't get introduced into our workplace and require a bunch of us to go into isolation ourselves. That's critically important. We can't afford to lose a lot of our own people because of that kind of a situation. So we're looking at a variety of ways to do that. Certainly screening of people as they come in, screening of our own staff is something we need to strengthen, and enabling people to work at home as much as possible so that we don't have everybody in one location who can all end up being exposed if we're not careful.
Do you have a follow-up question, Don?
No, that was great. Thank you, Dr. Gardner.
How about Dawn Huddlestone?
Hi, Dr. Gardner. My question relates to testing of confirmed cases. On the Health Unit's website, we're still seeing that the first identified case is self-isolating at home, and if I remember correctly, people weren't being removed from that list until they had 2 negative tests. So are those subsequent tests putting additional pressure on the testing system, and are they continuing those for the long term?
You are correct. Cases that are confirmed require full recovery and then 2 tests done 24 hours apart, both of them to be negative before they would be considered to be able to come out of isolation. All of this has happened over a relatively short period of time, a week and a half or so, and we're just asking ourselves now how best to facilitate their follow-up testing, considering that people right now have a hard time getting testing via the assessment centers and the emergency department. So we're seeking to work out an arrangement that would make it easier.
Do you have a follow-up question, Dawn?
I do, thank you. Is there any indication for either confirmed or more severe cases, how long this is lasting? I know it depends somewhat on the patient, but is there any sort of average appearing that would help people understand what this looks like?
According to the research, mild cases may very well be shedding up to 8 days or so, shedding virus, and so we're aware that individuals who never are tested, we would want them to be recovered and isolated for 10 days, whichever is longer, in recognition of that research of 8 days or so of shedding. For someone that's a severe case, this is new territory for us, but it could be many weeks for them to recover. People that end up in the intensive care unit on a ventilator, it's a very prolonged process.
Trina, do you have a question? Trina, you're on mute. Hello? for joining us this afternoon. We'll be doing this again tomorrow, and if you have any follow-up questions, please feel free to email myself or Leslie.
Do we know what time tomorrow?
Standard time will be 1 o'clock unless we have to change it.
Okay. Doug from the Muskoka region, just wondering why the gentleman from Deseronto is being treated in Newmarket.
I don't know, to be honest. That is southern Simcoe, and it could be proximity. That is a tertiary care center, but I actually don't know.
Okay, fair enough. Thank you.
Okay.
You're welcome.
Thank you, everyone.
Bye-bye.
Thank you.
Thank you very much.